When are we starting?
So we are going to start. She'll be starting, and she'll be Mr. Then everyone else. Panelist. Ah,
Is this work? Is this working for Dr. Kim, or he would say next slide?
okay, next slide. She should say. Yeah.
All right. Good evening, everyone, and welcome. My name is Michelle from ISF. I know I'm kind of starting a little bit later, but I'm just hoping to get started now. Your seats. On behalf of the organizing team, we would like to warmly welcome everyone and all participants joining us, including our member state representatives, our youth representatives, colleges, and colleagues, GMTC, partner organizations, and collaborating institutions, and all attendees across our sectors and regions. We are truly grateful to have you here for this important discussion. And we would like to highlight that we had over 300 people sign up for our online session, so we have about 75 people online as of now. So thank you to our online participants for joining as well. To share the aim and the dialogue of today's session, we would like to talk about how this session seeks to position youth as key drivers in advancing traditional medicine within global health systems. We also hope to explore meaningful youth engagement in the context of equity, accessibility, sustainability, and planetary. Traditional medicine holds a unique and increasingly important role within global health. It is an intersection between climate resilience, indigenous knowledge, sustainable development, and the intersection of biodiversity. Across many regions of the world, traditional medicine continues to support communities and health systems while also contributing to cultural preservations and environmental stewardship. At the same time, traditional medicine is increasingly becoming recognized as an sectorial area that requires collaboration across health, environment, education, culture, and policy sectors. So these conversations cannot happen in silos. They require collective action and diverse voices at these tables. We are also recognizing growing engagement from our young people, especially in rural areas connected to traditional medicine, climate action, and global health. Youth are leading initiatives, advocating within communities, and contributing to research and helping shape conversations around the future of health systems. However, despite this growing involvement, young people will face barriers when it comes to accessing policy spaces and particularly meaningful decision-making processes. Creating opportunities for intergenerational dialogue and youth inclusion is essential. So with today's gathering, in helping member states, GMTC, youth networks, and Indigenous and communities perspectives and partner organizations and collaborating institutions increase the shared dialogue. It is an opportunity to foster this collaboration across sectors, disciplines, and generations while building stronger communications and shared understanding. Finally, we would like to extend our sincere thanks to all partners, organizing members, collaborators, speakers, and participants for contributing to and supporting this session. Your presence and engagement are deeply appreciated, and we look forward to a meaningful and inspiring discussion together this evening. So to begin, I would like to introduce our first panelist, the Honorable Malakete Shekte, Minister of the Kingdom of Lesotho. He would like to join me. Our next panelist is going to be Mr. Gokul Rajendra. Would like to join us. Our next speaker is Dr. Z. Chow. Our next panelist is Dr. Evelyn Amaya. Our keynote speaker, Dr. Kim. Ms. Asle Yildirim. And Dr. Gustavo. So we'll begin with our keynote address, and then move into our panelists. Our keynote address is going to be on behalf of Dr. Shamaya Kuruvila, who could not join us, but we have the honor of having Dr. Kim Suncho. So it is my pleasure to introduce our keynote speaker, Dr. Kim. Dr. Kim currently serves as the unit head for traditional, complementary, and integrative medicine at the World Health Organization headquarters in Geneva. Prior to his role, Dr. Kim served as the regional advisor for traditional medicine at the WHO Southeast Asia Regional Office in New Delhi for 10 years. With extensive experience in traditional medicine, research, policy, regulation, and health system integration, Dr. Kim has contributed significantly to advancing traditional medicine within global health system. Dr. Kim holds a doctoral degree in biomedicine and traditional Chinese medicine, and also serves also has a master's degree in public health. We would love to hear from you, Dr. Kim.
Okay.
Please join me in warmly welcoming Dr. Kim.
Okay. Okay, thank you, Lisa, for giving me this opportunity. So today, actually, I'm on behalf of this Dr. Sharma Kudila, the director of the WHO Global Traditional Medicine Center, because she is the some other obligation in this time. So I just to state this on behalf of this Dr. Sharma Kudila. So I think today, I'm just to, because the agenda is the how the young people to advance in the traditional medicine. So I think my talks will be covering several areas. One, including that what challenge that the young people at the moment are facing in this new world, and also that what the role they can play in terms of traditional medicine, and then what is the linkage of the traditional medicine with the global health challenges, as well as I will be touching on some of the key point of the new global traditional medicine strategy, as well as what we are looking for, that some of the contribution from the young people in advancing of the global the traditional medicine. So I think the main issue is that because young people, if you look at this overall figure, I think the 2 billion of people actually at the age of the 10 to 24 years old. So I think that this is a huge potential and driving force in shaping the new world. So I think in this current context, in the climate change and environment deteriorations, as well as the lifestyle change, all these actually huge impact on the young people. So I think that we can see that the young people are facing a number of health challenges, including the mental health as well as the non-communicable disease. Many people are suffering from obesity and diabetes and cardiovascular disease. Actually, those diseases actually considered as the key problems for these elderly people in the past. But now the young people are also affected by those conditions. I think it will change the climate as well as the environment, all these interrelations actually not only impact our health, but also is impact the livelihood as well as the future. What is inspiring me when I look at these young people, because the young people are no longer waiting for the permission to make take the action, but they are actually already act. They're driving the innovations, they're driving the development, they're actually driving the whole as a main force in the shaping the new world. So what I strongly believe, young people is the future leader. At the same time, they're also the change maker for on today's. So I think that is the message I want to convey. Again, that the young people has this huge potential to shaping the new world and addressing these new global health challenges. And then I just will see. Okay. I think the slide is not perfectly sufficient. I think that I just highlight why traditional medicine is a matter now. Because what is the linkage that traditional medicine with the global has, that challenges. So I think, as you can see, that global community, almost half of the, that world populations is facing lack of access that, that basic and fundamental primary health care. That is a key issue. And also we see that, 1 in 4 people actually they are facing huge, catastrophic, cost risk because of the high, that cost of the health care. I think this is a key challenge that we are facing in the health sector. But we also realize that in the world, around 90% of the, that member countries actually they're using some form of the traditional medicine at the range of 14 to 99% of their own population. So it means that the traditional medicine has the potential to fill those gaps. So this is the one. And so we see that the global community also might be facing big shortage of human resources because we anticipate around 11 billion that has workforce shortage can be anticipated by the 2030. At the same time, we also realize that more than 2 million of the certified traditional medicine practitioners are existing in around 40 countries. Of course, if you look at other countries, it figure much bigger. So I think we need to properly utilize these traditional medicine practitioners. We might have opportunity to fill those gaps as well. We also have to see that global communities are facing NCD, because this is more than 75% of the global deaths attributed to non-communicable disease. But we also realize that member countries using that traditional medicine for the purpose managing and preventing non-communicable diseases. So I think that this is reported by the member country when we conducting the sort of global survey in 2023. So again, traditional medicine has a huge potential to managing those non-communicable diseases, as well as those key challenges that the world is facing. At the same time, traditional medicine has this huge that potential. So you can see that some international economists anticipate there is a huge around I think a 10 trillion US dollar market in the wellness industry. So I think at the same time we also realize that there is no proper regulatory mechanism for those wellness industries. So we need to have build some of the proper regulatory mechanism for this industry as well. I think we also global communities are facing that some of the 25% of the these medicinal plants is facing the extinction risk. So I think that is a huge challenge for traditional medicine sustainability. So I think we also look at this angle as well. And also we also choose the potential of traditional medicine because they have around 40% of the pharmaceuticals that's derived from the traditional knowledge as well as natural resources. So I think there is a close link between this extinction and modern medicine development as well. So I think I think that traditional medicine has such a potential to address those challenges that world communities are facing in different angles in different sectors. I think this slide actually shows that entire cycle of the traditional medicine is a value chain, because that is starting from the knowledge and biodiversity, and there is a financing mechanism as well as the health system related with the this regulatory system components as well. And also we also realize that there is a science involvement, technology involvement. However, also there is a huge potential to how we are going to validate those traditional medicine, efficacy and effectiveness, etc. in the future. And also we see that a huge market, that shapes in the traditional medicine. There is no proper mechanism to fair benefit sharing mechanism, and also there is huge issues related with the governance, how those inclusive and ethical governance can be controlled the traditional medicine sector. I think so. Again, each component of the whole traditional medicine sector ecosystem, there is a certain gaps. So why I highlight those gaps? Because I think in the future, young people could managing those and fill those gaps. I think that is what we are looking for in the future. So I think that this slide shows that how the young people can bridging tradition, innovation, and health for this. So again, if you imagine that the young people normally they're sitting with their family and grandparents, they get to know that what the medicinal use of plants, etc. So they already have modern digital technology, etc. Easy to they make documenting all this traditional knowledge. So somehow it can be preserved as a road to preserving the traditional knowledge as well. And I think we have to also understand that the traditional medicine has also an approach to managing young people's health conditions as well as well-being, etc. So I think we have to realize that how we can really harnessing those potential that the traditional medicine components that's related with the young people's health. And also that traditional knowledge also that including that here, kind of, traditional food systems and how promote such a, healthy diet and his lifestyle, etc. So these are some of the key elements can help young people to promoting their better health in the future as well. Of course, I would highlight that now the modern technology, digital technology, etc., actually one of the main concerns by the many people. There is a concern about the misinformation, how we can provide, that evidence-based proper information, particularly on traditional medicines. I think these are some of the key challenging issues that we are facing, and it's related with the intellectual property concerns and inequality with sharing and so on. So I think those issues, maybe I think as a young people, maybe look at those angles, and maybe we are looking for that young people can contribute how we can make such a good environment to deliver, disseminating proper information on the traditional medicine knowledge to the community. So again, there is a strong, recognition on the need that the young people engagement in the policy dialogue, because in the future, definitely I think that traditional medicine systems can be built by those young people. So I think that at the beginning, young people has to be fully engaged that dialogue of how setting the traditional medicine policies and etc. So I think these are some of the key elements I want to highlight. I take this opportunity to highlight that the global traditional medicine strategy, which was adopted last year, just 1 year ago in the 70-80s World Health Assembly. So I think this global strategy is a guiding that the global community, how we are going to develop this traditional medicine over the next decade. So as a global strategy has the vision that builds such a world which can be, allow people to access safe and effective traditional and people-centered healthcare, traditional medicines for health and well-being of all. So under this vision, global strategy has clearly set 4 steps to direction, how to build, evidence-based for traditional medicine and for the support to building on the build of those regulatory mechanisms, how to make sure that the quality, accuracy, and traditional medicine intervention. And also it has highlighted how best way we have an integrated of traditional medicine into national healthcare delivery system, which has to be appropriate to the country context and circumstances as well. I think in the strategy also highlight the importance of the cross-sectoral collaboration, because traditional medicine has such a holistic approach, has a vision that how to make it that, that health and well-being of the people, but also planet as well. So I think it requires that cross-sectoral collaboration among all stakeholders. A global strategy also have a setting several guiding principles. That's again, it's underpinning all the global across the global traditional medicine strategy, which including that evidence-based traditional medicine, holistic way to healthcare, as well as how we can make it a sustainable healthcare system through traditional medicine, how we are going to respect the human right on their healthcare, as well as the indigenous people, their own right and on their own indigenous medicine and so on. So this is a conclusion. So I think that young people has to be empowered, particularly as knowledge holders, and also they have more engaging to strengthen evidence-based, more participating research and innovation work as well. And also that they have to build inclusive and ethical, that governance and regulatory mechanism through their participation. And also we have to, that young people has to be more participating in promoting sustainable, biodiversity and so on. And also they have engaged for this, how we can protect this intellectual property right, which are related with traditional medical knowledge. And also that encourage them to all participate in the policy and research education and so on. And also that they have to use that digital technology more responsibly. So I think that that can be further support that, that the traditional medicine development. So with this, thank you very much for your kind attention. And I believe that in the future, that we are looking for that young people more contributing and as a key contributor to developing the traditional medicine for achieving health and well-being of the people as well as the planet. So thank you very much for giving us.
Thank you, Dr. Kim, for setting the stage so powerfully and for highlighting the importance of youth leadership, traditional medicine, and the cross-sectoral collaboration in shaping equitable and sustainable futures and showing us how we can lead. Thank you. So we'd like to move to our panel discussion. We have some amazing speakers, a diverse group, and we'll give them about approximately 3 minutes to answer your question, give some insight, and then as we can move on to the program. So our first panelist is Mr. Gokul Rajendra from the Govardhan app. He is a first final year BMS. He is a final year BMS student from Panikar Sodar Ayurveda Medical College under the Kerala University of Health Sciences. He is the founder of Govardhan, a biodiversity in traditional medicine project, a platform that is working to help people visualize the value of nature and protect it, particularly through traditional and indigenous knowledge related to biodiversity and medicinal systems. My first question to you, Mr. Gokul, is what are the major barriers young people face when trying to advocate for traditional medicine within global health and policy spaces?
Thank you so much. Hi everyone, thank you so much for being here everyone. Thank you so much WHO and thank you so much IPSF and thank you so much Mr. Plesato for being here. That's a really important thing for me. Just from my invite they came here, and yeah, thank you so much for everyone who joined us. So my name is Gokul and I'm from Kerala, India, and I'm a BMS student. So the main thing that I want to highlight about this issue about what are the main barriers that youth is facing is like, main thing is awareness that for traditional medicine, the youth is not aware about what are the opportunities that they can find, and also how they should go forward, because of a lot of confusion happening, because when they say something, they need to be proved every single time. And also there's a lot of other issues like there is like for us, like we don't know which is the best place to start working from, like as for me, coming into this international space, I had to find a particular spot where I can fit in traditional medicine, which was something I couldn't find. For me, that is that. Okay, hopefully you can hear me. So for me, it was like something to find, which happened to find it was like really hard. And the main problem was which ministry to go for, because different countries had different ministry setups. So for one of the ministries I reached out was Cameroon, and for them the medicinal department was in environment. So the environment ministry was handling the traditional medicine department. For us, it's like different. For in India, it's like a different entire ministry itself, like Ayush ministry. So when we went to when I went to health ministry and asked for like how can we work on traditional medicine, they told me this is not working. This is not working place. You have to go to Ayush ministry. So it's like there's like a lot of gap between the ministries where they have to bridge the gap. That is the one main thing that we as youth faced to find. And also the main thing is on research, and how can the research be done is also one of the main things that I think youth are facing, and the global acceptance. So for me to find support, it took me like two years. I think last World Health Assembly, like World Health Assembly 77, I was trying to have organizing one event, but it was like a little bit here and there. And finding support was really hard for us starting out in this field. But yeah, right now we actually made it happen. But yeah, so these are some of the main issues that I think youth is facing in textile medicine. I mean,
Thank you all for your perspective, especially as a young youth in the space and trying to make and pave the path for us. It is very important to know your perspective and how you have been working really hard. Our next question is going to our Honorable Minister of Health, Ms. Honorable Mama Kido Mekido. Sorry. And she's the Minister of Health for Mekido Mexico. She is leading the nation's effort to strengthen healthcare systems and manage global health priorities and enhancing the well-being of the best of people. Minister Nakete actively collaborates with global bodies like global health organizations to help ensure equity and sustainable healthcare financing for the country. My question to you, is that the Africa region holds a promise for expanding the leadership of young people in advancing traditional medicine. We know that up to 75% of the population in Africa is under the age of 35. But often, line ministries have challenges in working closely together as they could offer for a cross-sector impact. How can national leadership be strengthened to allow in all of government?
Thank you very much, Lucia. And I would like to thank everyone, especially Google. You know, something is coming to my mind as I'm about to speak. I don't know, for some reason, the traditional, this traditional medicine thing keeps following me. And there's probably a reason for that. I grew up in a rural Lesotho where traditional medicine has always been the first line of care for me. And now living in the cities became less and less accessible. But one of the things that stands out for me is the fact that my very first visitor in the office, I just joined the ministry. So my very first visitor was a young person in traditional medicine that was seeking guidance because he was struggling. Like the same thing that Google was mentioning about the struggles of young people in traditional medicine. So probably there's something in this that I have to follow up. So in the Lesotho, we recognize the importance of traditional medicine as it is not far-fetched since more than 50% of the medicines used in modern medicine are from medicinal plants. Our country, like many other countries, has rich base of indigenous medicinal plants. Therefore, integrating the traditional medicine, modern healthcare in Lesotho has the potential for enhancing improved health outcomes. Traditional medicine offers holistic approaches to healthcare, but it requires extensive evaluation for safety. There's a need to generate evidence, document it on the existing medicinal plants so that cultural practice, which we so much embrace, must be safe. Their efficacy should be tested. Hence, we need for us to partner with our universities. Our nation acceptance and community accessibility underscores its relevance, yet regulatory challenges persist. Therefore, Lesotho is working on its regulatory authority to even the WHO advocates for comprehensive regulatory frameworks that promote the safe use of traditional medicines while safeguarding public health. Integrating traditional medicine into the modern health care is a big topic in Lesotho because traditional healers are the first point of contact for most of the Lesotho listeners, like I said, especially in the rural areas. They are everywhere, even in remote villages where clinics are far, they speak the same language and understand local customs, and they are part of the community. Now, when it comes to youth advocacy, now traditional medicine, youth can play
as pharmacists, practicing pharmacists, we're able to provide that holistic care and have cultural competence when providing that care that involves traditional medicine. But how do we get to this education? And I'm not just talking about education in school, I'm also talking about having educational resources, continued education as we grow and learn when practicing. To start off, I completely agree with what you said about regulatory concerns. There needs to be a legitimization of real world evidence. I find that because traditional medicine has hundreds, not thousands of years of lived experience evidence, observational data, but often that's kind of pushed aside because we say, well, we don't have our gold standard, our randomized controlled clinical trials. But if you ask me, those hundreds of thousands of years of experience, to me, that is basically the longest form of what we consider phase 4 of clinical trials, when it actually reaches the patient and we see what happens in real population. So there needs to be a legitimization of that form of evidence.
And then with that evidence, and that data collection, there needs to be more data collection of that sort of evidence, we can put it into regulatory frameworks to ensure that these traditional medicines can be safely applied and incorporated in clinical guidelines, as well as that education for pharmacy students and pharmacists of the future. And then just in terms of what more youth can be engaged with, traditional medicine is an oral tradition, classically speaking, and I think the youth can really channel that in, and we're all very social media savvy, and although there's a lot of misinformation that can be found on social media, the youth can be fighting that with the good information that we learn in our education. So thank you.
Thank you, Z. As a student myself in my second year of my pharmacy, hearing from you is a motivating factor as well, because thinking about my education, I have limited exposure to traditional medicine, and now we're just jumping into medication dosages, durations. And it's something that I would love to learn how to advocate for. So hearing from people in the government through students like you is very inspiring. Our next speaker is Dr. Evelyn Mabayasa. She is the Acting Administrative Secretary of the Traditional Medicine Practice Council in the Ministry of Health in Ghana. She is a globally recognized healthcare executive and public health leader with over 2 decades of experience advancing healthcare innovation, strategic partnerships, and health systems strengthening across Africa, Asia, and the Americas. She currently serves as the Acting Administrative Secretary of the Traditional Medicine Practice Council. Our question to you, Dr. Evelyn, is how can governments create more meaningful opportunities for youth participation in traditional medicine policymaking and implementation?
Thank you for the question, and thank you everyone for inviting me to this session. Like the Honorable Minister said, once you get your foot in traditional medicine, it finds you. This was not part of my plan under WHA79, although I worked very hard to find a session. I couldn't find any side events that were listed, so by way of faith, I got connected with Govardhan and his team, and so I'm very glad to be here. And I bring you greetings from the Minister of Health of Ghana, who is very big in traditional medicine. So for those who may not know, according to the WHO, over 70% of Ghanaians use some form of traditional medicine. Traditional medicine is very interwoven into our community, such that we have a whole act of parliament that established the council within which I lead, the Traditional Medicine Practice Council. We regulate, we promote, we standardize, and we accredit all traditional medicine institutions in Ghana. We also have a directorate within the Ministry of Health that is in charge of policy formation for traditional medicine. Traditional medicine is so integrated into our healthcare system, where we piloted 55 integrated units in hospitals. We did an evaluation of that, and it showed that people really want access to traditional medicine. So we're expanding that integration strategy to include more hospitals. One other thing that I would want to mention before I tackle the question, and it will all make sense when I tackle the question, is that we are also working on an essential medicine list for traditional medicine. As most of you have heard, Ghana has launched a pre-primary care program, and we cannot divorce primary care access from traditional medicine, because that's where most people go, as the Honorable Minister said, happens in Lesotho. The first point of entry is traditional medicine. So we have to find ways to integrate traditional medicine into the pre-primary care process. With all that said, it is therefore very imperative for the government to create meaningful participation for the youth to be engaged in traditional medicine policy making and implementation. We need to move beyond the symbolic consultation by giving youth real influence, resources, and leadership pathways to be involved and in the effective participation. And effective participation usually includes institutional inclusion, education, innovative support, and community engagement. So you may ask, what are some of the ways that we could do this? We could create formal youth participation structures where the youth is included in advisory council for traditional medicine policies. Right now, we create these policies around traditional medicine. At least for my country, we do not actually include the youth. So that's a place where we can include them. We can include the youth in national traditional medicine regulatory boards, like my board, for instance, does not include a youth representative. And this week, I had been thinking about that to go back and tell my board chair that we may want a youth observer on our board going forward because this is very important. We can integrate traditional medicine into our educational systems. This is not happening right now, at least not in my country, but it would be a way for us to maintain the interest in the area, because a lot of youth always perceive traditional medicine, at least in Ghana, as something that older people are concerned about and not something that the youth should be concerned about. So if we include it in our educational curriculum, maybe we can start to sensitize the youth around being involved in traditional medicine. I had a conversation with somebody recently who said that they didn't even know that you could go to the university to be a medical herbalist and learn about phytomedicine. So this is an area of discipline that we need to publicize a little bit more. We can fund youth-led innovation and entrepreneurship. One of the areas that we talk about is biopiracy and knowledge preservation. This is something that the youth can be involved in. Either we organize hackathons, all of them are using, I don't know how many of us are all using AI. They're much more well-versed in the technology world than we are. So this is something that we can actually include the youth, the policymakers and ministries of health and governments can actually think about. So in conclusion, what I'm saying is, I know I only have 3 minutes I can go on because this is an area that I really love and can speak the whole day about it with you. But in conclusion, we need to include the youth in the implementation, not just for consultation, not just having them sit on the sidelines. This is very heartwarming for me, and I want to go back to Ghana and really organize the youth around this. We'll be talking about hackathon to really drum up interest in the traditional medicine area, and you guys are giving the encouragement to go back tomorrow and get that done. So more to come on that. Thank you.
Thank you, Dr. Evelyn. I'm fueled up by listening to you and seeing your passion. And it's so awesome to see you advocating for students to become involved on the board and having our voices be projected. So thank you so much. And we'd love to see the progress you've been made.
Beautiful.
Yes. Our next youth representative is, she's a panelist. Her name is Ms. Asle Yildirim. She is the representative of Eurocam. Eurocam is the European Foundation uniting umbrella organizations of patients, physicians, practitioners, and veterinarians in the traditional complementary and integrative healthcare sector. She is a biomedical scientist based in Belgium with a master's degree in biomedical sciences from KU Leuven. Her background includes stem cell research, genome editing, molecular biology, alongside broader interests in global health, integrative medicine, and equitable healthcare systems. My question to you, Asle, is what can research institutions learn from community knowledge and lived experiences in shaping the future of healthcare systems?
Thank you very much for this valuable question. First of all, I feel extremely honored to be able to be here with you and to be able to listen to all your very valuable points of view. And I am extremely excited as this is the first time I'm holding such a microphone ever. And I believe this question is very important because I think currently our research institutions can really learn that health is not something that's only shaped in laboratories, but it is something that's also shaped in families, communities, environments, cultural practices, daily lives of people, and even within the healthcare systems themselves. So, and in this aspect, I believe community knowledge, which for me highlights the lived experiences of the people, can really help us to better understand what people actually need in terms of what barriers they face in their lives, what they trust, and how healthcare is experienced in reality, both within and outside institutions. And sometimes community knowledge, very importantly, can reveal us some gaps between how healthcare systems are meant to work, how they're designed, and how they actually are working in reality. And for me, of course, this doesn't mean to replace scientific research or lowering scientific standards, but it does mean to expand the questions that we ask and recognizing that health and well-being are also influenced heavily by social, cultural, and environmental aspects that cannot always be fully captured within controlled research settings alone. And coming from a biomedical science background myself, I've increasingly reflected on these questions, both through research that I've done myself and through also personal readings on broader discussions around integrative, complementary, and traditional approaches to health. So, which often highlight the importance of such lived experiences, as well as prevention and person-centered care. And if research truly wants to serve people better, I think it should not only ask what works statistically, but also it should be able to ask for whom it works, in which context they work, and whether if care is genuinely accessible for people, and whether it is meaningful and responsive to people's lives. And I think when discussing such an important topic of future of healthcare systems and what can research institutions learn from them, this is especially important because true healthcare should not only be scientifically advanced, but it should also be humane and socially responsive. And it should also be very much connected to the realities of the people. Thank you very much.
As Lana was so inspiring, especially bringing the humane and the lived experiences perspective. I think sometimes we get so focused on the science part that we kind of forget, lived experiences can be data, should be used as data. So thank you so much for that. Our next representative, youth representative, is Dr. Gustavo H.M. Dalecorte. He is from the International Federation of Medical Students Association. He is the liaison officer for public health issues. He recently graduated from medical school. He's a medical doctor from the Federal University of Pereira, and he is a global health advocate and currently serves as liaison officer for the IFMSA. He has held national leadership roles in IFMSA Brazil and has served 2 years on the national public health team, as well as 6 years as a local coordinator working across public health, human rights, medical education, and reproductive health. He is a founder and former president of the Academic League of Public Health, UFPR, with research experience in malaria, immunization, epidemiology, and more. My question to you is, how can we better foster respectful collaboration between biomedical systems and indigenous or traditional knowledge in ways that we can preserve the integrity, values, and autonomy of both?
Hi, thank you for your question. Thank you all for joining us. Thank you for the invitation as well. I know it's a very beautiful afternoon, so thank you for your staying until my comments. And I would like to start with a very sad statement. My friend in Canada said she had one class in her pharmaceutical college. Me, as a Brazilian, I had none. So I think that's way worse. And I would like to say also that I had a bit of a background in indigenous medication. I have researched for a bit of a time into applications into Chagas disease. So it is a topic that I always look very kindly to. And so I'm very honored to speak to you today. I think first, to answer your question, we need to acknowledge the power imbalance between we have the traditional science, the traditional evidence-based medicine, hard medicine that we see in the West to the traditional ones, and to the native, indigenous traditional ones. And between this power imbalance, we must ensure three main principles. The first is that every time we create a policy, every time we try to integrate this knowledge into the most standard care, we need to have a co-creation. So it needs to be a collaboration between doctors, nurses, pharmaceutical people. It needs to be a co-creation. It cannot be just unilateral. So it's not just from me to you. It needs to be both. Second, it was talked a lot during this panel about the intellectual property. And I believe this is a very important issue because the colonization still exists. We see this every day, but we don't want to give it a name. But when you take the knowledge of a population and you apply it without giving it full rights, you are colonizing a person, you are colonizing a culture. So a very fundamental point is that we acknowledge whose intellectual property it is and give eventual royalties. The third point is integration without integrity, not assimilation, not engulfing a culture, but acknowledging its differences and working with it. I think these are the main points that we need to do to integrate the hard biotechnical medicine that we find today, the health sector that we find today, with the traditional knowledge. Does that answer your question?
That did answer the question, and I think you brought up a great point of international or interprofessional collaboration, including traditional medicine, pharmacists, medical doctors, nurses, and using the healthcare system, government officials as a way to make sure we drive change. So can I get another round of applause for our amazing panelists? Awesome. So before we close the panel discussion, we'd like to invite each person, each panelist, including Dr. Kim, to give one final takeaway or message for your audience in under a minute. Hard, I know.
Thank you very much, Michelle. I think the main takeaway for me is the greatest disability that we have had as people, the disability of including young people. As my colleague from, is it Ghana? Yes. As my colleague from Ghana said, we always forget young people. Yet, if you want to see how far any country wants to go, you must look at how we treat their youth. Because youth is our future. So that is a great disability that I'm noticing and that we should deal with. Thank you.
Yeah, for me, a call to action for me would be that we need to build a strong model of co-creation with the youth. The youth, traditional practitioners, scientists, government must jointly come together to design policies and implement them for the greater good of all. Traditional medicine is here to stay. It's not going anywhere. A lot of people use traditional medicine. We need to make sure that we test the efficacy of traditional medicine, that there's clinical research around it, the efficacy, the interaction with other drugs, that is safe to use, that we create a world where nobody who goes to seek traditional medicine for themselves or their loved ones does so with harm to themselves or to their loved ones. Thank you.
So first of all, I'd like to thank everyone in this panel. Also, I'd like to thank all the audience. So what I thought throughout this Q&A session was that I think we all had different perspectives, but also different ways of tackling each question and putting our answers forward. And I find this reflecting actually a very valuable tool for the future. And I believe it is extremely important what we're doing here today, as I also see this conference being organized by young people. And I really genuinely believe that as young people, we are the generation that will live with the long-term consequences of today's decisions. So we should also help shaping them by asking new questions, challenging inherited assumptions, and helping to co-create better healthcare systems.
My key takeaway will be a bit more specific to the healthcare workers and I guess policymakers also listening. For sure, one day you're going to get a patient that asks you about traditional medicine and you're going to want to know the answer. So always advocate for access to that knowledge, have it in your education, and have it accessible throughout your career. Thank you.
I didn't want to talk about you because I'm at the moment of my life that I start to be on the dark side of youth, in which the 35 start to come more into reality. But as a youth advocate, yes, I would like to strengthen 3 points. Advocate for a decolonized curricula. I did it because we did not have a family traditional medicine in our curricula and across the university, so they could include. They didn't, but still we should try. Support community-led research with the involvement of the community that you are researching, and you are co-leading in research in specific drugs or knowledges. And challenge destructive practices within our institutions, wherever you are. You can do this. You should do this. Most countries have open channels to do this. And if they don't, it's up to you to create them. And a final takeaway, empathy, respect, these are the keywords that must exist between these 2 words that can cooperate, but so often collide. So,
okay, yeah, thank you. Thank you for giving me the opportunity. I think I want to highlight that 2 things. One, maybe health is not simply absence of disease. It's the balance of the mind and body. It's the balance of the, the people and planet. It's the balance of the tradition and innovation. It's the balance of the past and future. So I think that I'm so happy that today we have this opportunity to see, hearing all these young people actually interested in traditional medicine, because there is a huge growth. I can see that, because that normally traditional medicine quite neglected by many people. But I think I see that the huge growth is the engagement of the young people. So I think ideally looking for that young people more engaging in the traditional medicine development. It can make that the health sector become more holistic, and it really can contribute health and well-being of the people as well as the planet. So thank you very much for giving us this opportunity.
The key takeaway for me would be like hope. I am seeing a lot of hope here now. We have more people, young people, and also more ministerial participation, support from different councils from different countries like HANA, coming together to support us to take this research and knowledge forward. I see a lot of hope here. So I was here at 2022, sitting at the same place you guys are sitting right now, starting with my project work on making traditional medicine better for everyone and globally accessible. But from there, it was a journey of doing some asking people around, like connecting with young people, getting them to onboard and doing a lot of things on making this happen, making go forward in the discussion of traditional medicine. And at World Health Assembly 77, we were like walking the talk, and Maria Nair, the director of climate change and health in WHO, she told me like, okay, you should keep on going. There is hope. That's the hope you should keep on within everyone, and share that to the youth in back in your country as well, to that people youth that there is hope. They should persist on keeping it up and pushing forward. So this session has given me that hope again. Thank you so much for everyone.
Thank you so much to our wonderful panelists and Dr. Tim for the insightful reflections and passionate, just inspiring messages. We're excited to see what we can do from here. Now we have a special video addressing Ms. Fiona Nehebe. She's a community-based researcher and founder of Tremendous Organics in India. That was an important contribution to the Indigenous spirit and narrative for that video. The opportunity for us to learn from you. Sorry. So now we have a short series of videos from youth representatives. Our first is from Geneva. Our next video is from Anita Aminu Tangoa. She is a young Shawty Indigenous leader from Peru. She's trained in nursing and is an active community health and nutrition outreach. She represented Indigenous youth at the 2023 UN World Forum of Indigenous Health Youth at FAO. Our next speaker is a young Indigenous Maya warrior and a spiritual guide from Guatemala, and the daughter of a traditional healer. She is a trained She's trained as a lawyer to defend community indigenous rights and has experience in ancestral medicine, traditional knowledge, and human rights policy work and community work. Currently practicing as a certified attorney and notary. And we have statements from your camp and Nacho. Thank you for sharing. So we would like to do, I know we're kind of running out of time, but if you want to open up for like one or two questions, we can do that to our audience. And then we also have the refreshments after. So I guess we can take two questions. If you'd like to introduce yourself briefly and just make a brief question, brief intervention, and maybe suggest one of the panelists you'd like to answer.
Hi, my name is Yujin and I'm from Korea and I'm from the delegate of IPZ, which is International Pharmaceutical Students Federation. And thank you for the lecture, for the session that I'm very glad that traditional medicine plays an important role in like this kind of global health discussion. In Korea, in Korea, traditional medicine is still a very large active market, and all pharmacy students study Harvard medicine for several semesters as a part of formal curriculum. But still, we have some ongoing tension between Korean medicine and modern medicine. So, and also, two of the best-selling OTC products in community pharmacies are herbal medicines, but they are regulated under different standards than conventional drugs. So, as I mentioned in this session, the regulatory kind of process or criteria is different from modern medicine. So I want to ask about what should it specifically require for the traditional medicine different from modern medicine?
Would any panelists like to respond to that question?
Yeah, I'm happy to.
Okay.
So, if I understand your question right, you are asking what the difference, what should there be a different criteria for evaluating Western medication and traditional medicine, correct? So I can share with you what we do in Ghana. So we have sort of the same standards for traditional medicine and Western medicine. They're all regulated by our Food and Drug Board. So the council that I co-lead regulates the practitioner, but sometimes we cannot divorce the practitioner from the practice or the manufacturing of the medication. So to bridge that gap, the FDA CEO sits on our board and we sit on the FDA board so that we are comparing notes and doing the right thing. It is the same standards that we're using to evaluate. Of course, Western medications are not manufactured in Ghana, so there's a set of criteria, but the same things that you're looking for is efficacy, good manufacturing practices. You cannot say, and I don't know about other countries, but you know, there's certain practitioners in Ghana that say that their drugs can cure 101 ailments. The FDA, the FDA requires that you narrow that down to 1 or 2, so that it's consistent with how we evaluate the Western medicines. But I say that with a caveat as well, right? Because with traditional medicine, there is not a lot of robust research that goes into it as it happens in Western medicine per se. So we do our best. It's not a perfect science, and we're evolving in the way that we're evaluating, but at least there are certain core practices that or things that we need to see. And even when we send evaluators out to China, to India as well, to evaluate medications before they come into the country. And there's a checklist that is being used to ensure that we're bringing in safe drugs to the country. But it's a difficult balance because this is still an area that is evolving. I don't know if that answers your question.
Thank you. And before we kind of close our discussion, we have a written statement by Esther for your Kim, if you'd like to present it.
Today, I'm standing here after many conversations, reflections, and concerns shared by other young people within the Eurocam Youth Delegate Group, for which I'm deeply grateful. As young people, we understand healing as something that extends beyond clinical care. For many of us, health is becoming a wider conversation about dignity, prevention, balance, sustainability, mental well-being, and the ability to live meaningful lives. We fully recognize the contributions of conventional healthcare systems and research institutions in improving lives and developing better treatments and solutions for human health. At the same time, many of us feel increasingly disconnected from and unheard in the conventional healthcare systems that often become overly focused on short-term treatment rather than prevention and long-term well-being. We believe this is one of the reasons why many people in Europe and around the world continue to rely on traditional, complementary, and integrative healthcare approaches. The growing interest in TCIH is therefore a part of a wider search for more preventive, participatory, culturally responsive, and holistic understandings of health and well-being. We, as the young generation, don't want to be symbolic statements of youth inclusion, nor passive observers. Faced with these concerns, we want to participate actively and meaningfully in shaping conversations and developing the future of healthcare and well-being that places people at its center. Thank you very much.
Is there any questions from the chat? I think there's one. There's a question in the chat. Are most young people being trained in TM doing it to formal or informal training context? So any panelists want to go for that? And how can we integrate traditional medicine without reducing them solely at evidence-based validation, without losing the cultural and social, territorial, and spiritual dimensions? So, any panelists wanted to go for?
What's the question?
How can we integrate traditional medicine with scientific medicine without reducing them solely to evidence-based validation and without losing their cultural, social, territorial, and spiritual dimensions? Any panelists? Okay.
I'll try. I'll give my best. I think it's a very complex topic because it is a system of knowledges that it is as complex and as important as the traditional Western medicine, the scientific and biomedical medicine. So it is the easy answer to just do a course or do a full-on lecture sessions about it, but it will highly depend on where you are from. And I believe it is most beneficial if we try to do the anthropological approach. I studied history before medicine, so I know a little bit about that. And I think that in this context, having a bit more of humanities in the medical curricula, in the pharmaceutical curricula, or in the health curricula in general in universities, where we learn not only to respect or to have empathy, but to take off, I'm not sure how to translate this to English, but to take off our clothes as Western, our clothes as a Brazilian from blah, 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 take it off and put it be a blank page so you can absorb what the other gives to you. So when you go to a native population or an indigenous population, you can reflect their ideals. You will not be able to replicate, but you will be able to respect and to include the traditional healers that you work with. Okay, I try my best.
I would like to add into that. Mostly it is the community that we need to engage with. So it's like community based. So mostly that will be the best thing to do to make it more solely and get more people to like without losing the without losing the social, cultural, and spiritual dimension. The culture, everything comes from the community itself. So we should have the community engagement, which makes it the best. So I would like to go for one more statement from our one of our knowledge partners, which is UN University. And so they have been sharing as they recognize traditional medicine, and they wanted the indigenous to be inclusive, resilient, and be part of the sustainable health systems. And they believe that the youth are key catalysts in the process, driving forward transformative ideas and sustainable solutions that align with the principles of equity, inclusion, and long-term resilience. So this is a statement by Dr. Niti from who's the lead for nature, climate, and health in UN University. And this is something what I want to share with them, with you guys. Thank you.
Thank you everyone for joining us today and contributing to such a rich discussion. And we have reinforced that traditional medicine is just beyond healthcare system. It involves experiences, culture, youth, and young people. And that we have clearly heard that young people are not just simply stakeholders for the future, but they're active leaders, innovators, and knowledge stewards that are already shaping solutions today. On behalf of our organizers and partners, thank you to everyone, especially our keynote speaker, Honorable Minister, Dr. Evelyn, Dr. Gustavo, Dr. Slid, and Gogo for being here and taking time to speak with us and making sure that we get participation. We hope this discussion contributes to stronger partnerships, deeper collaborations, and more meaningful youth participation in traditional medicine. And we hope you took something away and are able to see a vision and feel fueled and passionate as I have. Thank you and have a wonderful evening. We do have some refreshments for you. Please feel free to engage and discuss and collab with everyone. Thank you.